This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Hi, everybody. I'm Caroline Pupke. I am the academic chief at Emory University PM&R. I'm joined by my co-chief, Justin Jerzowski. He's our administrative chief. He'll be doing part of the presentation as well. I'll start off, and so if you have any questions, Justin will be monitoring the chat, so he'll be happy to answer those. So to get started, we'll just have a little bit of an overview. We'll go over the rotation schedule and the sites that we get to go to, as well as the academic and didactic experiences, where our residents go after residency, what makes Emory unique, and then life in Atlanta. And just to start off with, we're an advanced program, so we start as a PGY2. So if you were to match here, you have to have a separate intern year. We do have an opportunity that you can do a transitional year through Emory at Grady, but you just have to note that interest when you apply for our program. So just to start off with, I'm going over our rotation schedule a little bit. So it is broken into 2-month blocks. As a PGY2, like most programs, it's pretty inpatient heavy, but we do have 2 months of what we call Wesley Woods, which is our outpatient rotation. It's kind of a mixed outpatient rotation with sports med clinic, spine clinic, some cancer rehab. You go to a skilled nursing facility and do consults, as well as some prosthetics and orthotics and neuroimaging. The rest of our PGY2, like I said, is more inpatient heavy. You do 4 months at Shepherd Center doing spinal cord injury and brain injury, and then 6 months at the Emory Rehab Hospital, which is kind of our main location as a PGY2. You do stroke rehab on our 3rd floor, which are stroke and brain injury floor, and then you do 4 months split into 2 months each on our medically complex floor. Acute Rehab 1 for medically complex is more of our spinal cord injury patients, and then our Acute Rehab 2 for medically complex is some of our transplant patients, LVAD patients, and some of our multi-trauma patients. As a PGY3, you do some inpatient, but a lot more outpatient rotations. You can do pediatric rehab at CHOA, which is Children's Hospital of Atlanta. That's 1 month of inpatient and 1 month of outpatient. We also rotate at the Atlanta VA doing a general musculoskeletal clinic, which includes EMG and injections. We work at Grady as well, doing EMG as well as consults. And then you do 1 month of inpatient rehab back at Emory Rehab Hospital on the stroke service, and then a 1-month elective, which you can kind of develop yourself as long as you're staying within the Emory system and you're doing something 5 days a week. And then as a PGY4, it's mostly outpatient. You do 1 month of inpatient rehab on the stroke service, and you do an elective for 1 month, but otherwise you're rotating through different outpatient clinics. So you're doing sports medicine, spine and pain clinics and procedures, getting more of that EMG exposure. We also go to the VA again and do some more general musculoskeletal outpatient. At the VA as a PGY4, you also do med rehab, which we work with rheumatology and neuroradiology, as well as do some spine procedures. And then, like I said, you go back to inpatient rehab and elective. So just going over some of our different locations that we get the opportunity to rotate at. Shepherd Center being one of our big core sites. There's dedicated spinal cord injury and brain injury teams that we rotate with on both our PGY2 year, and then we do an additional rotation of spinal cord injury as a PGY3. You also, during that time, do home call. So with home call, it's about Q3 throughout the week that you split between the residents that are there. But with that home call, you do have the in-house ICU, which has pulmonary specialists, including the attendings and the APPs. And the APPs are actually in-house during your home call. So if there's any emergencies, they're able to cover those, which means you get a little more sleep. Shepherd Center is a very unique place. It's a world-class facility. You get to see very high-level complex injuries, including vent-dependent patients, because it's technically an LTAC. and it's actually rated top 10 in the rehab hospitals for US News and World Report. So it's a great experience. Like I said, for PGY2 and kind of throughout our residency, Emory Rehab Hospital is kind of our home site, our home base. You do stroke service and medically complex there, like I mentioned in that kind of overview of our schedule. We do have internal medicine physicians and a nurse practitioner available 5 days per week, which is nice to help kind of manage some of the medical management, including like hypertension and diabetes and even some nephrology issues that we come up with occasionally. Unique aspects of Emory Rehab Hospital specifically, like I said, we get a lot of transplant patients, which is pretty unique. We're right next door to the Emory University Hospital, so they send a lot of their patients to us for rehab once they get their transplant. So that's a unique experience getting to co-manage those patients with them. And then we also get LVAD patients, which is a left ventricular assist device, kind of can be a stopgap for people who have heart failure, but also prior to them getting a heart transplant. It's a unique experience. I actually had never seen an LVAD patient until I came to Emory. So it's something that, you know, you see once and then you're able to help manage it throughout your career if that's something you're interested in. At Emory Rehab Hospital, we do in-house call. You won't be on both, obviously, Shepherd call and Emory call. It's separate. With in-house call, though, you do get a post-call day, which is nice. And at most, it's about 5 times per month. We also rotate at Grady Hospital as a PGY3. Grady is kind of the largest hospital in the metropolitan area. They serve most of our community. It's a level 1 trauma center. It's also an ABA verified burn center, a comprehensive stroke center, and a safety net hospital. So you're getting people from all different backgrounds and a lot of diverse injuries. We see a lot of traumatic brain injury and spinal cord injury, a lot of polytrauma. They do also have a mobile stroke unit, so they're getting to those patients with strokes much faster, which means better outcomes. We do also do an outpatient spine clinic with fluoro procedures with Dr. Hinrichs, which is fun to do. We have a spasticity clinic with Dr. Branch and Dr. Carson. And we also do EMGs with both neurology and our PM&R physicians to get those numbers and that experience. Recently in April, we actually opened the brand new inpatient rehab unit at Grady. Not currently being staffed by residents, but there is a potential residency expansion to cover that in the future. But it is unique that on the consult service, you now get to see that side of when you see a consult saying you think they're appropriate for your rehab, which is fun to do. We also rotate at CHOA as a PGY3, which again is the Children's Hospital of Atlanta. That's where we do our pediatric rehab. We do inpatient and outpatient 1 month of each on that rotation. You get to see a lot of different injuries. You get to see a lot of different diagnoses, including cerebral palsy and muscular dystrophy, as well as some brain injuries and spinal cord injuries. We also get a lot of procedure exposure on this rotation as well, with Botox injections, phenol injections, and baclofen pump management. And CHOA also has a robotics lab, which is one of the few robotics labs in the country. And so that's a great experience that we get to do while we're on that service. I will say too that Emory does offer fellowships in pediatric rehab, brain injury, and spinal cord injury, as well as sports medicine. So you get to rotate with people that you might continue doing fellowship with if you're interested in that. We also rotate at the VA Medical Center, like I mentioned. This is primarily an outpatient rotation, and you get to do peripheral joint injections, spinal injections. You get your EMG exposure here, as well as prosthetics and orthotics, which we have a dedicated clinic for. We also have ultrasounds available at the Atlanta VA, and so we get to do a lot of our injections ultrasound guided, especially if we're feeling comfortable doing that on our own. We work at the Emory Musculoskeletal Institute as well. We do this in our PGY2 and some in our PGY3, but primarily most of our exposure is in a PGY4 year. It's a fairly new building. I think it's about 4 or 5 years old. It's a hands-on spine care in the new, like a brand new musculoskeletal institute with state-of-the-art technology, including imaging on site, ambulatory surgery, therapy, and a huge research space that we get to use if we're interested. Here, you're going to get a lot of your fluoro-guided procedures. Our residents have no problem getting their numbers for their fluoro-guided procedures. I think I got mine as a PGY2 on that Wesley Woods rotation. And so if injections is something and procedures is something you're interested in, this is a great experience. It's also one of the main sites that we do our nerve conduction studies and EMGs to really get those numbers and that experience. We also rotate at the Sports Med, the Atlanta Hawks facility, with several of our different faculty members. This is primarily as a PGY4. You get a lot of diagnostic ultrasound training as well as ultrasound guided procedures, and you get to train with leaders in the field of sports med and orthobiologics, including Dr. Mountainer, Dr. Bowers, Dr. Kinnear, and Dr. Olafade. So that's a great experience because you also get to work on athletes. So especially people interested in sports medicine really love this rotation. As far as our didactics and lecture curriculum, so we have a core curriculum. We have lectures every Tuesday and Thursday morning, and it repeats on a 12-month cycle. That lecture time is protected time, so you're not responsible for patient care or answering pages during that time, and the attendings are aware of that. And so with that repeat cycle, our residents see each topic about 3 times, which really bolsters kind of that education prior to taking our boards after we finish residency. We do monthly journal clubs as well. Currently, we have a spine and orthobiologics musculoskeletal journal club, which is run by our residency director, Dr. Monfred, as well as Dr. J. Rum, who's a leader in orthobiologics. And we also have Dr. Ma, who is a biostatistician that comes in and also kind of helps us review journal articles. We're also planning on starting a TBI and spinal cord injury journal club in that same format. In terms of learning and more of our core curriculum, so we do use Canvas for competency modules that residents can use along during their rotation for rotation-based learning. A lot of the learning in the modules comes from Kugarillo, which is kind of the PM&R board review book that we use. With those competency modules, we do post-rotation assessments, so it's like a Canvas quiz. We also do recorded lectures that residents can review, which is nice, especially if you're post-call or on vacation, you still have access to that information. And we have a lot of board review materials, not only on Canvas, but also on our SharePoint, which you get access to as a resident. We have an annual Emory Sports Medicine Symposium that you're able to go to if you're interested. Part of our didactics also includes morning report conference 5 times per year and M&M 3 times per year, which is morbidity and mortality conference, which is a great experience for our residents to get, more comfortable doing oral presentations and presenting interesting research that can potentially lead to a publication or a poster at a conference. And that we also do specialty lectures. So we do billing and coding to prepare you for the real world once you finish residency. Again, financial education, helping you get insurance set up or whatever you might have questions about. We have a VA attending who does acupuncture and does a workshop for us, as well as some lifestyle medicine. And any resident request, we're happy to accommodate as well for better learning. We do a lot of hands-on workshops during our didactics, which our residents really enjoy. One of our biggest one is our MSK ultrasound block. We have a dedicated block to learn diagnostic ultrasound as well as ultrasound guided procedures with our sports med faculty and fellows, which you can see in some of these pictures below. Besides our MSK ultrasound workshops, we also do EMG workshops. We have a cadaver anatomy lab every year, so we can review some of those important muscles and nerves that are important in PM&R. We do spine procedure workshops with our spine attendings and fellows. We also do botulinum toxin workshops for spasticity and migraines, baclofen pump management workshops. We do a seating and wheelchair clinic at Shepherd. And like I said previously, we do an acupuncture workshop with one of our attendings at the VA. And now Justin's going to take over and talk about a little bit more about our program and opportunities.
Yeah, so kind of taking over with the global health opportunities. So we have the GHRSP through Ethiopia, in addition to a program with the Dominican Republic. Both of these are sort of international opportunities for residents to provide PM&R coverage broadly. Additionally, we have research projects with the WHO. And then other residency perks. So we have moonlighting opportunities as a PGY4 at ERH or other local areas within the Atlanta community. Additionally, we have a $1,500 stipend per conference. You also get 5 education days to be allocated to those conferences. You have a $900 book allowance over your 3 years. And then additionally, we have funds that go towards dinner, breakfast, lunch, other meals at ERH. Shepherd provides free lunch as well, also dinner if you're on call. And then additionally, CHOA also provides meals while you're on inpatient. Our residents, we're not going to go through the whole list, but they go broadly into all areas of PM&R. As you can see, we go pretty evenly split between fellowship trained versus general physiatry. We have a lot of residents as well that have chosen to stay on within the Emory community. And so things that make Emory special, so we have tremendous sports coverage. As you can see in the photos, we help with the Peachtree 10K, which is the largest 10K in the world, every 4th of July. That falls under the mass coverage events. We help cover the high school football games each year in all of DeKalb County. And then additionally, we also assist with providing Emory freshman sports physicals in addition to other local colleges. And then we have an annual welcome party at one of our attendings' houses. It's actually coming up this weekend for us to welcome in our PGY2s. And then we also do an annual wellness retreats. Sometimes we stay local, other times we go into the Blue Ridge Mountains, which are just a short drive north of Atlanta. And then additionally, we've created a lot of great relationships with our attendings. We started to do a lot more social activities, such as the Braves games with Dr. Tu, one of our EMG and general MSK attendings. We started to do an annual kickball game, as you see in the bottom. And then other activities we've done is sort of going on the Beltline or going and floating down the Chattahoochee River. Living in Atlanta, temperate climate, is putting it lightly. We have a lot of humidity here right now, but it's a great city overall. A lot of green space. You have both an urban and suburban population very quick access from where everybody lives. As stated, you have a short drive in North Georgia to go into the mountains and the cabins. Additionally, you have access to a large international airport that can take you pretty much anywhere in the country or the world quite quickly. And then also you have some relatively short road trips as well to other cities in the Southeast region. Plenty of sports as well, if that is your interest. And then we also have a lot of cultural opportunities such as music, concert, food and wine festivals, and farmer markets all throughout the city. So why Emory? You have a broad experience in all of PM&R, prepares you for any fellowship or job, as Caroline's already mentioned. You have countless procedural opportunities. We are never at a shortage for our numbers. You get a lot of specialized neuro rehab experience across the whole spectrum. We have level 1 trauma consults at Grady, moonlighting opportunities as a forward to expand your independence as a practitioner. Life in Atlanta is great. You have a lot of cool opportunities with the city life. And then we also have amazing faculty, staff, and residents that continue to expand our PM&R team and family here in Atlanta. So thank you very much for listening. We appreciate it. We're happy to take any questions if you want to unmute yourselves or just put them into the chat over the next 5 minutes or so. And then please follow us on Instagram or Twitter or X, whichever one you prefer now. And then Caroline and my email are there at the bottom of the screen. We'd be happy to answer any questions that might come up throughout the interview season. So feel free to reach out to us. Just to kind of keep the conversation going, Caroline had mentioned some of the fellowships. We also have the NAS fellowship in addition to PAIN. Our residents have gone on. Our residents have gone on to go into both of those fellowships. Additionally, Emory has started a pretty unique opportunity here, which is an interventional physiatry fellowship. We have our first fellow starting this year. And so that focus is going to be trying to do all things interventional within the field. So back fin pump refills, spasticity management, some of the basics of interventional spine as well. Just trying to expand, the opportunities for the general physiatrist and getting more hands-on procedures. As I've kind of mentioned, our families continue to grow. 4 of our recent graduates have all stayed on for either fellowship or general training or general practice here. The interventional, sorry to interrupt, interventional physiatry fellowship, I believe, is 1 year. So similar to many of the others, just pediatrics is the only one currently that's 2 years. But yeah, we've had 4 of our last 6 graduates all stay within the Atlanta community. They've gone on to work at Grady and Emory. So, we have a continuing growing family and a lot more opportunity to train with, practitioners in all aspects of their career.
All right, like Justin said, if you guys have any questions, feel free to reach out to us. We always answer our emails because we get a lot of them. And like he said, to follow our Instagram, our other X or Twitter. We're going to do some like day in the life stuff. We do a sneaker feature Friday. So we try to be as interactive as possible with you guys, but we appreciate you letting us speak to you tonight.